The public health issue I would like to talk about is nutrition, physical activity, and obesity. Living everyday life with good nutrition, physical activity, and managing a healthy body weight will reduce a person's risk of developing high blood pressure, high cholesterol, diabetes, heart disease, stroke, and cancer. Most Americans do not follow a healthy diet and exercise plan that is needed to maintain proper health. Over 72 million Americans are obese. Over 15% of the population in each state is obese. Healthcare cost of obesity was $147 billion in 2008. 1 in every 3 adults, an even lower proportion of adolescents, do not eat the recommended amount of vegetables daily. 81.6% adults and 81.8% adolescents do not get the recommended amount of physical activity daily. As a result of this laziness, America is experiencing a huge increase in obesity. Overweight and obesity increases medical costs and causes a burden on the American medical care system. One cause of obesity is poor nutritional environments in schools, workplaces, and hospitals. Some Americans do not have the funds to afford healthy foods, so they buy what they can afford, and that's usually processed food, which is high in calories, fat, and sodium. Increased sodium intake leads to high blood pressure, which increases the risk of heart attacks and/or stroke. A decrease in exercise is also a factor of obesity. Some Americans have limited access to parks, recreation centers, and safe walking routes. I would like to propose a policy that will mainly target young children. Implementing healthy food choices and exercise at a young age will become habit for these children, so they will less likely be obese when they're older. The early care and education programs is to prevent obesity and educate providers about health benefits of improving nutrition, increasing activity, and limited screen time in the child care setting. The program will also encourage child care providers to assess their centers to identify where improvements are needed, as well as implement nutrition, physical activity, and reduce screen time. Increasing to healthier food opportunities by implementing farm-to-preschool programs and joint use agreements. The DNPAO funds state-level efforts to prevent and control obesity. Through the NPAO, 25 states receive funds to develop obesity plans to prevent obesity and chronic diseases through healthy eating and physical activity. The policy is intended to educate public health employees, providers, and decision makers about the current conditions that exist in their state and help inform efforts to prevent obesity. The policy is state-funded. The benefits from improving the treatment and prevention of early childhood obesity include more educated healthcare professionals, provide child care employees education on strategies about physical activity and nutrition, focus on maintaining a healthy weight amongst young children and families. The policy will also focus on affordable, healthy eating, as well as opportunities for physical activity on a community level. The lives of people following this policy will change due to the fact that they are given healthier food choices and places to engage physical activity. They will be living a healthier lifestyle and will not be at risk for chronic health issues. Early care and education is designed to target young children and educate them on the importance of healthy eating and physical exercise. Although there has not been a lot of obesity research done on the young age group, implementing this policy will help the U.S. reduce the number of obesity in America. Early care and education programs are important for obesity prevention. Child care centers and family child care homes provide care for an estimated 30 to 40% of children under the age of 6. Children spend 30 or more hours a week in these child care settings. The ECE staff develops these children's health behavior and can reduce the risk of obesity by implementing more physical activity and offering healthier food choices.